Pathophysiology is the study of how normal physiological processes are altered by disease. It helps us understand what happens inside the body when things go wrong. By exploring the mechanisms behind symptoms and disease progression, pathophysiology bridges the gap between basic science and clinical practice. This field is essential for healthcare professionals, as it provides the foundation for diagnosing, treating, and preventing diseases. In this video, we'll journey through the core concepts of pathophysiology, using real-world examples to make complex ideas easier to grasp. Let's start by defining the basics and why this knowledge matters. Bodies constantly strive to maintain balance, a state known as homeostasis. When disease strikes, this balance is disrupted. For example, in diabetes, the body can't regulate blood sugar properly, leading to a cascade of effects. Understanding how diseases disturb homeostasis is key to grasping pathophysiology. This disruption can affect organs, tissues, and cells, resulting in symptoms that we recognize as illness. By studying these changes, we can better predict disease outcomes and tailor treatments to restore balance. Every disease has an origin, known as its etiology. Etiology refers to the underlying cause or reason for a disease. It could be genetic, environmental, infectious, or a combination of factors. For instance, the etiology of tuberculosis is infection by Mycobacterium tuberculosis, while hypertension may have multiple contributing causes. Identifying the etiology is the first step in understanding how a disease develops and progresses. This knowledge guides prevention and treatment strategies. Pathogenesis describes the sequence of events that occur from the initial cause of a disease to the manifestation of symptoms. It's like following a story from the first chapter to the last. For example, in atherosclerosis, the process begins with damage to blood vessel walls, followed by inflammation and plaque buildup, eventually leading to heart attacks or strokes. Understanding pathogenesis helps clinicians anticipate complications and intervene early. Diseases often cause visible changes in tissues and organs, known as morphological changes. These alterations can be seen under a microscope or with imaging techniques. For example, cancerous tissues may show abnormal cell shapes and sizes, while inflamed tissues might appear swollen or red. Recognizing these changes is crucial for diagnosis and understanding how far a disease has progressed. Morphological analysis bridges the gap between microscopic events and clinical symptoms. Signs and symptoms we observe in patients are called clinical manifestations. These are the outward expressions of the underlying pathophysiological processes. For instance, fever, pain, or swelling are common manifestations of infection or inflammation. By linking clinical signs to their pathophysiological roots, healthcare providers can make more accurate diagnoses and choose effective treatments. Understanding these connections is vital for patient care. Diseases can be classified as acute or chronic. Acute diseases develop suddenly and last a short time, like the flu. Chronic diseases such as diabetes or hypertension persist over months or years. The pathophysiology of acute and chronic diseases differs, influencing how they are managed. Acute illnesses often require rapid intervention, while chronic conditions need ongoing care and monitoring. Recognizing the difference helps tailor treatment plans for each patient. Inflammation is a protective response to injury or infection. It involves immune cells, blood vessels, and molecular signals working together to eliminate harmful agents and start healing. However, excessive or prolonged inflammation can damage tissues and contribute to diseases like arthritis or asthma. Understanding the balance of inflammation is key in pathophysiology, as it can be both beneficial and harmful depending on the context. Cells can be injured by various factors such as toxins, lack of oxygen, or infections. If the damage is severe or prolonged, cells may die through processes like necrosis or apoptosis. Cell death contributes to organ dysfunction and the symptoms of many diseases. By studying how and why cells are injured or die, we can develop strategies to prevent or limit tissue damage in conditions like heart attacks or strokes. Genetics play a significant role in the development of many diseases. Mutations or inherited traits can increase susceptibility to conditions like cystic fibrosis or sickle cell anemia. Understanding genetic contributions to disease helps in predicting risk, diagnosing conditions early, and developing targeted therapies. Advances in genetic testing are transforming how we approach disease prevention and management. Our environment can have a profound impact on health. Exposure to pollutants, chemicals, or infectious agents can trigger or worsen diseases. For example, air pollution is linked to respiratory illnesses, while contaminated water can cause outbreaks of infectious diseases. Recognizing environmental risk factors is essential for public health and disease prevention strategies. Immune system protects us from infections, but sometimes it malfunctions. Autoimmune diseases occur when the immune system attacks the body's own tissues, as seen in lupus or rheumatoid arthritis. Immunodeficiency disorders, on the other hand, leave the body vulnerable to infections. Understanding these disorders helps in developing treatments that restore immune balance. Infectious diseases are caused by pathogens like bacteria, viruses, fungi, or parasites. These organisms invade the body, multiply, and disrupt normal function. The pathophysiology of infections involves the body's defense mechanisms and the damage caused by the pathogen. Effective treatment targets both the pathogen and the body's response to infection. Neoplasia refers to abnormal and uncontrolled cell growth, which can lead to tumors. Benign tumors are non-cancerous, while malignant tumors are cancerous and can invade other tissues. The pathophysiology of cancer involves genetic mutations, altered cell signaling, and evasion of the immune system. Early detection and targeted therapies are crucial for successful treatment. Degenerative diseases involve the gradual loss of function in tissues or organs. Examples include Alzheimer's disease, which affects the brain, and osteoarthritis, which damages joints. The pathophysiology often involves chronic inflammation, cell death, and impaired repair mechanisms. Managing these diseases focuses on slowing progression and improving quality of life. Metabolic disorders disrupt the body's chemical processes. Diabetes, for example, affects how the body uses glucose, while hyperthyroidism speeds up metabolism. These disorders can lead to a range of symptoms from fatigue to organ damage. Understanding the underlying metabolic changes is essential for effective management and prevention. Vascular disorders affect blood vessels and circulation. Conditions like hypertension, atherosclerosis, and aneurysms can compromise blood flow and lead to serious complications such as heart attacks or strokes. The pathophysiology involves changes in vessel walls, blood pressure regulation, and clot formation. Early detection and control are vital for preventing complications. Nutritional disorders result from imbalances in nutrient intake, such as deficiencies or excesses. Malnutrition can weaken the immune system and impair growth, while obesity increases the risk of diabetes and heart disease. The pathophysiology involves how the body processes and utilizes nutrients. Addressing these disorders requires dietary changes and sometimes medical intervention. Exposure to toxins or chemicals can cause acute or chronic injury to organs and tissues. Examples include lead poisoning, drug overdoses, or industrial chemical exposure. The pathophysiology depends on the type of toxin, dose, and duration of exposure. Prevention and prompt treatment are essential to minimize long-term damage. Physical injuries, such as fractures, burns, or wounds, disrupt normal tissue structure and function. The body responds with inflammation, repair, and sometimes scarring. The pathophysiology of trauma involves immediate and long-term changes, including shock or organ failure in severe cases. Early intervention and rehabilitation are important for recovery. Aging is a natural process that increases vulnerability to disease. As we age, cells and organs lose efficiency, repair mechanisms slow down, and the risk of chronic diseases rises. The pathophysiology of aging involves genetic, environmental, and lifestyle factors. Healthy aging focuses on prevention, early detection, and maintaining function. Diagnosing diseases involves a range of tools, from physical exams to advanced imaging and laboratory tests. These tools help identify the underlying pathophysiological changes and guide treatment decisions. For example, blood tests can reveal infections, while MRI scans show tissue damage. Accurate diagnosis is the cornerstone of effective medical care. Treating diseases requires understanding their pathophysiology. Therapies may include medications, surgery, lifestyle changes, or rehabilitation. The goal is to correct the underlying problem, relieve symptoms, and prevent complications. Personalized medicine, which tailors treatment to individual needs, is becoming increasingly important in modern healthcare. Preventing disease is as important as treating it. Strategies include vaccination, healthy lifestyle choices, and regular screenings. Understanding pathophysiology helps identify risk factors and develop effective prevention programs. Public health initiatives play a vital role in reducing disease burden and improving community health. Diseases can lead to complications, which are additional problems that arise during illness. For example, diabetes can cause kidney failure or blindness if not managed well. Understanding the pathophysiology of complications helps in early detection and intervention, reducing the risk of severe outcomes. Disease progression refers to how a disease advances over time. Some conditions worsen rapidly while others progress slowly. Monitoring progression helps in adjusting treatment plans and predicting outcomes. Understanding the stages of disease is essential for effective management and improving patient quality of life. Recovery involves the body's natural healing processes. After injury or illness, tissues repair and function is restored. Some diseases resolve completely while others may leave lasting effects. Supporting recovery with rehabilitation, nutrition, and medical care is crucial for regaining health and preventing relapse. Prognosis refers to the likely course and outcome of a disease. It depends on factors like disease type, severity, patient age, and response to treatment. Accurate prognosis helps patients and families plan for the future and make informed decisions about care. Advances in medical science are improving our ability to predict outcomes. Ongoing research is expanding our understanding of pathophysiology. Innovations in genetics, imaging, and therapeutics are leading to new ways to diagnose, treat, and prevent disease. Staying informed about the latest advances helps healthcare providers offer the best possible care to their patients. Summary: pathophysiology is the key to understanding how diseases develop, progress, and affect the body. By exploring causes, mechanisms, and outcomes, we can improve diagnosis, treatment, and prevention. Whether you're a student, healthcare professional, or curious learner, a solid grasp of pathophysiology empowers you to make informed decisions about health and disease. Thank you for joining this journey through the fascinating world of disease mechanism.